Hello everyone and welcome to this audio podcast. This audio podcast is part of the ShiZMode Chapter. This audio podcast is part of the shitstorm Panzer. This audio podcast is part of the analysis and expose and is part of the analysis and expose and robotics. This audio podcast is part of the Geronimo, and this audio podcast is part of a Storm Robotics production. Through this audio podcast, I look at the conclusions. So the uptake of tech across healthcare sort of sectors, around healthcare sectors, and around healthcare sectors uh, 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 can be advantageous and can be advantageous in around where tech is utilized is utilized to help advance aspects of healthcare services in across between healthcare sectors, but also in across populations. Data science and bioinformatics techniques can be sort of applicable or important to draw insights from tech, thus prompting safer prescribing in around particular treatment modalities and monitoring of medications and precluding overprescribing. Individuals prescribed nephrotoxic medicines and drugs, also requiring dose adjustments in where there can be a suspect or high risk for suspect or high risk for example in around renal insufficiency in amongst care and nursing homes can be identified utilizing again sort of data science techniques or aspects pertaining to data science techniques and bioinformatics. This also allows or prompts tech supporting medicines management for care home or nursing home residents who could be prescribed particularly nephrotoxic drugs or treatment modalities to be more to be to be to be to be monitored sort of more effectively. At the same time, at the same time, efforts are needed or required to reduce probability of late referral if there is a suspect or high risk of in around, for example, AKI, acute kidney injury, or chronic kidney disease or CKD, and integrated and in line to where medical notes, aspects of medical notes with tech are integrated, which then can enhance a sort of healthcare service practices and prompt early screening. Ultimately, healthcare professionals and sort of collaborations between healthcare sectors are required for best practices. That draws this audio podcast to a close. This audio podcast is part of the ShiZMode Chapter. This audio podcast is part of the Shitstorm Panzer. This audio podcast is part of the analysis and expose and robotics. This audio podcast is part of the Geronimo. And this audio podcast as part of a Storm Robotics production.